Hello, ladies and gentlemen. Welcome to season 2, episode 2 of the HIA show. Today, you're privileged to have me give you some updates on COVID-19 and vaccination that is going on around the world. In this edition, we're going to take a little bit dive into what is really going on in Ghana, in the United States, around the world. In terms of vaccines, we've all been trying to, look forward to this vaccination, the biggest that is going to ever happen as of now. The largest vaccination program that mankind has ever seen is under rollout. And we want to see how the vaccines are actually distributed according to countries, according to states, and the trend that we see amongst individuals in other countries and even in the United States. Are they receptive for the vaccine? Are we having a lot of vaccine hesitancy? And for that matter, we're going to look into what really contributes to some of these factors. So without much ado, I'll take a little break. And then when we get back, we will talk about what is really going on in the vaccination or against COVID-19. All right, so welcome back once more time. We'll be looking at how COVID-19 vaccines are being distributed around the world. What are the factors that are influencing the distribution of the vaccine? And also talk a little bit about what is going on in other countries such as Ghana, right? As we speak, you can see that we have the global distribution of vaccines, as you can see on your display. You realize that certain areas such as the United States, Europe's, they're all in green. What it means is that at least you do have about 10% of people that are being immunized one way or the other. More than 422 million people have been administered the vaccine. The whole world population is in the billions. So looking at this picture really doesn't tell us the whole picture of what is really going on, but it gives us a global view or a global perspective of what is going on in different continents around the world. Unfortunately, if you look at continents such as Africa, we are really, really behind. You can see that we don't really have much green. We are all the way at the extreme, which means at least one person out of 100 hasn't even been vaccinated. That brings us to the next topic about what COVAX is doing in order to help us overcome this issue. So COVAX is just a WHO kind of coalition that is actually trying to get about 20% of countries that can afford these vaccines to actually get some vaccines. So as we are aware, especially those of you from Africa and in Ghana in particular, Ghana just got hold of one of these vaccines that we are privileged to give to our people back home, and we know that is from AstraZeneca. So at least Ghana was the first country to receive it. After that we do have countries like Ivory Coast, Nigeria, and all these other countries receiving. The Caribbean, you have people actually getting these vaccines. So what it means is that as we go along, and again, I'm going to play a video of what COVAX is doing, and I want us all to understand what the WHO is doing to help all these other poor countries or other countries that don't have much money to battle with these big countries for vaccines. So,
and solidarity, if you follow.
The UN-backed scheme to ensure that people from less wealthy countries are protected against COVID-19 is being hailed as a historic moment. The arrival of 600,000 vials from India marks the beginning of a massive campaign that will see more than 2 billion doses delivered to several developing countries across different continents.
This COVAX program is about equity.
So that video that you're watching is pretty much telling us what the COVAX program is about. And that was the first delivery that we had to Ghana. You saw that being received at the airport. And that is pretty much what is giving us that leverage to be able to have some vaccines in Ghana from AstraZeneca. So COVAX, which is the WHO's agency or the committee that is really helping to make sure that the distribution of vaccines actually reach other countries as well.
Richer countries have been able to buy far more vaccines than poorer ones. And while COVAX has managed to raise $6 billion, it needs at least another $2 billion to meet its target for 2021.
This COVAX is only financed now so we can reach in 92 countries the most vulnerable population, the older citizens, the health workers, people with comorbidities, But we need much more vaccines and financing so we can vaccinate everybody, just like if you want in the rich world.
Correct. So we are looking at how we're going to help people get vaccinated. Even when you're found in a country that has no chance of competing with these big countries, COVAX is trying to help generate enough vaccines for at least 20% of the population. Because, infectious disease, if you don't tackle it as a global concern, there's no way you'll be able to overcome it. So I think there should be concerted efforts to help most countries get a lot of their population vaccinated.
Of vaccine have been administered globally, but half of those are in just 2 countries, and 80% are in just 10 countries. More than 200 countries are yet to administer a single dose.
After a year of disruptions due to the pandemic, there's hope that this is the beginning of the path to recovery for those most affected and those that are most vulnerable. Sarah Khairat, Al Jazeera.
Right. So as you saw in that video, it pretty much tells everything, right? Most of the vaccines are going to the richer countries, and most of the poor countries are yet to receive even a vial of the vaccine. That tells you the disparity or the inequality when it comes to the distribution of the vaccine. But when you're fighting an infectious disease of this magnitude, you always want to make sure that every country kind of benefits from the vaccines. I know countries like Israel have taken a lead, and they've actually vaccinated almost half of their population. And it's telling us that the more vaccines, and you're going to show later on that the more vaccinations you have, the better your chance of actually, running up the curve when it comes to this pandemic. So we are advocating, and a lot of people that are in helms of affairs and those who are in control to be able to look at other countries and kind of either donate the vaccines to them. And I know some countries like Canada and the United States are doing likewise, support the WHO so that other countries that don't have the money can also get some of these vaccines. All right. So, looking at all of that, it tells us that this is a global issue, and we all admit it. So we need to make sure that we go according to that. So yes, COVAX, like we mentioned, is an organization that is really helping other countries such as Ghana secure these vaccines. Because if it wasn't that organization, a lot of countries would not get any vaccines, and you need the health workers to be vaccinated, as we're going to learn very soon. There's a very chilling video coming from the African WHO meeting that was recently held, where a nurse from Ghana was telling the group about what is really going on with infection rates in Ghana amongst nurses. So let's take a minute and look at that video.
Thank you very much. I bring you greetings from Ghana, and specifically the Ghana Registered Nurses and Midwives Association. Yes, COVID has not spared us as health workers. In Ghana, already as at 4th March 2021, we've had about 4,585 health workers who are infected. And as at October 2020 last year, we had about 14 deaths. And this is information from the Ghana Health Service. We ourselves as a union also collated our own data. And as of July 2020, we had about 840 of our comrades being infected. As at then, we had 3 deaths, and the rest of them fully recovered. As at January this year, we had 789 of our comrades who were infected, and the death toll has risen to 6. This is no different from the stories that we hear from our sister African sister unions and other African countries, and globally. Health workers have not been spared. When we look at the figures, we know that over 100,000 have been infected, over 17,000 have died. This, of course, means that although we are health professionals, we know more about diseases and its impact and so on, we are not immune to the COVID-19 virus. And that is the more reason why we have called on all stakeholders, especially our national governments and so on, to prioritize the vaccination of health professionals. What I can share with you is that in Ghana, the vaccination rollout was initiated on the 2nd of March. And we had our President, His Excellency Nana Addo Dankwa Akufo-Addo, leading the way by getting vaccinated first, together with his spouse and the Vice President and his spouse. The program of the expanded program on immunization of the Ghana Health Service was to ensure that there are various phases of this immunization program that will span from March to October. And the March to October simply means that not enough vaccines are available at a time to vaccinate everybody. The first batch of vaccines that were received was through the COVAX system. And at the moment, out of the over 140,000 health professionals or health workers in Ghana, we know per the figures from the Ghana Health Service that 60,398 have been vaccinated. The first phase of the vaccination covered 3 regions out of the 16 regions in Ghana, and that was the Greater Accra, Ashanti region, and the Central region. And that together meant that we were looking at a figure of 66,686 health workers. And out of this number, we know that 30,974 are nurses and midwives. So if we know that as at yesterday, 10th March, already 60,398 health workers have been vaccinated, then we want to believe that majority of our nurses and midwives have also received the vaccine. One thing to note is that this vaccination is not restricted only to the public sector. It also covers the private sector. So much focus is also on the community pharmacists, who are almost the first point of call for most Ghanaians, and in fact, not only in Ghana, but in most African countries. When somebody is having a headache or is coughing, the first point of call is a chemical shop or a pharmacy shop.
Yes, so as you saw in that video, it's pretty much, giving us a summary of how health workers are being vaccinated in Ghana, which is pretty good. We expect the trend to continue. The numbers is kind of like almost half of the people have been vaccinated. We encourage that a lot of people, or we encourage the number of, the trend or the awareness, among the people, increase the social media awareness so that people will actually have more answers to their questions, so that they will be more convinced to vaccinate. Because let me show you this, or you watch this. So if you look at how vaccinations in the other worlds, so you can take a look at this particular trend, right? So if you look at the number of cases that you will see and the number of vaccinations, as you can see on this particular diagram, you realize that as the number of vaccinations increase, you see that the trend in infections decrease correspondingly. what it means is that it is very important to get a lot of people vaccinated, especially healthcare workers. In cases, especially in Israel, where a lot of the healthcare workers and people who are vulnerable, the older population are vaccinated, you actually see a drastic decrease in the number of cases of COVID-19. So, talking about all of that tells us that it's important to get vaccinated in order to overcome this pandemic as well. Now, let's take a little quick dive into what is really going on when it comes to, like, for instance, vaccination around the United States. You see that a lot of the places are at least in green, which means that minimum of about 20% of the population are getting immunized, right? You have certain areas that are struggling with rollout. But at the same time, you see that there is a very good increase in number of vaccination, with the United States currently sitting at 22.2 million doses a day, which at that particular rate, going at this rate, the expectation is that it's going to take about close to about 5 months for us to achieve about 75% vaccination. Looking at the same trend that we're looking at when it comes to the whole world, 10 million people are getting vaccinated a day. Looking at this rate, it will take us years to be able to achieve 75% herd immunity. We are looking at, especially in the US, you're looking at about 70 to 85% herd immunity in order to be able to round up this pandemic. But looking at the rates at which you're going, it take 5 months in the US, it take about 5 years around the world. But the good news is that there's more vaccines coming out. And the more we get more vaccines being approved, the higher the chances that we'll be able to go around and actually be able to overcome this deadly disease as well. Now, let's take a look at what is really going down in Ghana at this point. So number of cases in Ghana seems to have kind of declined a little bit just a couple of months ago. There was an increase. And as you can see from this graph, you realize that there was a peak. You get a little bit peak around February, which has started to decline in Ghana. But at the same time, we have to be very cautious about how we control the infection. You see the same thing on this particular graph from the Ghana Health Service that shows that there was an increase in February, and now there's a trend of decrease, which is good news, but at the same time, you have to tread cautiously. So these are all things that we need to pay attention to when it comes to controlling the infection in countries like Ghana and so forth and so on. Now, like I mentioned, today's show is just an update, pretty much just giving you some information, what is going on. There was some issue about AstraZeneca's vaccine that was halted in certain countries in Europe. And recently we received the news that most of these have been lifted, or the review of the clots that was associated with the death of certain individuals who took the vaccine has been cleared. And now what we see is that there is actually an increase in vaccination with AstraZeneca vaccines. So it's been declared to be safe and effective. No issues. The risk and benefit, actually the benefit outweigh the risk. And also the link wasn't that strong to suggest that they should pull the vaccine out. So there's still ongoing vaccination. And especially in Ghana, there wasn't any pause in the vaccination as well, because it was Germany that actually started that pause, and other countries followed likewise. However, after it's declared to be safe and effective, the vaccination still went on. So these are all things that I think that are good and positive when it comes to vaccination. I think that the only way for us to go back to normalcy is actually get a lot of people vaccinated. And I'm very confident that if we were to get people rallied up and get a shot in their arms, we will get more people vaccinated, more people immune, stop the spread of the virus, which doesn't stop us from still observing the protocols, right? So, for instance, the CDC just came out with, some recommendations that says that if you're fully vaccinated, the expectation is that you can actually gather indoors with fully vaccinated individuals without really wearing a mask also, you can gather indoors with unvaccinated people that are not at high risk. If you're around someone who has COVID-19, you do not have to quarantine or test unless you have symptoms. And then you should take steps to protect yourself, of course, so that because we're still learning more about how this affects people who are vaccinated and the spread of infection. So these are all things that I think, as our listeners, we want to, admonish you to actually pay attention to some of these things as we go forward in the vaccination efforts. So today's session is supposed to be just a 30 minutes informational session. If you have any questions or concerns, you can always send it to us. We'll be willing to answer it for you. So we have Stephen Yeboah watching us all the way from Atlanta. Thank you very much for watching. But before we wrap up the show, which is just informational at this point, there's no discussion. It's just me telling you what is really going on in around the world in terms of vaccination efforts. What we're going to do is that we have a video that HI has put together that is supposed to be shared with a lot of people. But before we bring that video, I'll take a little break. And then when I get back, we will show you the video, and then you post the video on our YouTube feed as well. You'll get opportunity to share that particular video so that will make people more, confident in the vaccines. I have taken the vaccine. The first shot was okay. The second was also good. And, from what we know now, after 2 weeks of getting vaccinated, you will have an immunity, or you have some protection against the virus. So we are advocating that people get, those who are hesitant. At this point, you have millions of people, 423 million people around the world have taken the vaccine. And one thing you should remember is that a lot of vaccines that have been given in the past showed, severe symptoms or any kind of side effect that was untoward in the first 60 days. So far, we've overcome that first 60 days. We still haven't seen any major issues, but it's only positive news you're seeing. We're seeing trends going down in terms of vaccination and what have you. So again, please, when you get opportunity to vaccinate, don't think about it twice, because I always say this, there are only two ways to get immunity. It's either you get infected or you get a vaccine. Now, when you get infected, there are multiple things that can happen, but one of them is actually death, which we don't want, because one life is too many, right? So we are trying to advocate that everybody who has opportunity to get a vaccine should do it. In the United States, we are at the phase 1B, where a lot of people who are, frontline workers, people who are essential workers, teachers are all getting vaccinated. Very soon it will hit the general population. So we are hoping that other countries will get to this level in the near future. But however, make sure that you protect yourself, keep other people from getting infected, observe all the protocols, and keep the numbers down, because the lower the numbers, the higher the chance that we can actually overcome this disease as well. So again, like I said, I'm going to take a little break. When I get back, then I'm going to show you the video. We're going to premiere the video, and you can catch that video on our page as well. So today, let me just recap what we've talked about. We've talked about the fact that COVAX, which is WHO, has really helped a lot of countries secure some vaccines, especially for their health workers. Now, we know that COVAX is part of the WHO that is helping poor countries to be able to get vaccines. We showed that Ghana was the first country to actually benefit from the COVAX rollout of vaccines, and we did display all of that. We also realized that if you go to countries like Ghana, the health workers are getting vaccinated. We see about almost half of them are getting vaccinated. We're encouraging that they should increase the media presence, let people explain and convince all these health workers to be able to get vaccinated. Because if your health workers are strong and immune, then actually we'll be able to solve the problem if it goes out of hand. We realize that the trend, especially in Ghana, in cases actually around the globe, is kind of plateaued, and in some places it's going down in trend. So, which is good news. And we also showed that statistically, if you look at Israel, which has almost more than half of its population vaccinated, and even at least almost 90-something% received one dose of the Pfizer or Moderna vaccine, you see there's a corresponding decrease in trend when it comes to the number of people who are getting the infection. So the positive note is that, yes, the vaccines are doing something. The only fear we have at this point is that there's increased chances of variants that will come out there that maybe our vaccines might not be effective against. We've shown that for some of the vaccines, they are effective against these variants. For some of them, their efficacy is kind of reduced. So these are all things that we've talked about today. And I think if you're listening to me, make sure that you protect yourself if you don't have the vaccine. But then if you have a chance to get the vaccine, you should go ahead and just do that as well. So like I said, I'm going to take a break. When I come back, I'm just going to play the video, and I want you to share the video and share the feed as well. Right, so welcome back. And again, I'm going to roll the tape. I want you to share this feed so that everybody who, is not convinced about, getting the vaccine will be more confident to do so.
Good day, everybody. My name is Santa. I am a pharmacist, and I'm the co-founder of Health Info Africa organization. Today, I'm going to share with you my experience of getting the vaccine. Hopefully, this video makes you a little bit more comfortable with receiving the vaccine. If you have any questions, comments, or you just want to say hello to me, feel free to leave a comment down below on this video. Please do not forget to like, share, and subscribe to our channel. Thank you. Stay tuned.
Hello everyone, welcome to HIA. My name is Jada Santi-Selby. I am a family nurse practitioner, and I will be your guest interviewer today. Today I'm going to be interviewing Dr. Asantwa Depakofari, so please let's welcome her. Hello Asantwa.
Hi, how are you doing?
Oh, I'm doing fine.
Good. Thank you for having me today.
Of course. So, what vaccine did you receive?
So actually, I got Pfizer's mRNA vaccine, which is 2 doses. The first dose you get on day 1, and then the second dose you have to wait for about 21 days after. So let me just explain this mRNA spike protein, since I've gotten so many questions about it. So the actual coronavirus is made up of different types of proteins. They chose the spike protein. So this spike protein is on the outside of the virus. They place the spike protein's mRNA into small, tiny little oily droplets. Once injected, it makes a body easier to absorb into your cells. So your cells will use this spike protein mRNA to produce it, and your immune cells will recognize these spike proteins and produce antibodies to fight against it. This is when persons might feel the side effects everyone is talking about, such as pain in the injection site, fever, headache, fatigue, and some body chills. So for instance, after you get vaccinated, and in the future, if you get infected with COVID, your body will already have the antibodies to fight the infection. So you won't get severely sick. Luckily, my symptoms on the first dose, I got a little pain on the injection site and fatigue. Now on the second dose, I actually had the same pain in the injection site, some body chills, and a low-grade fever.
So what advice would you give people who are still hesitant about taking the vaccine?
Yeah, so I understand their concerns. I understand that they said that the vaccine has came out too quickly. There's not enough studies about this vaccine. So let's actually think about this. This is actually a global pandemic. So we've had so many persons that we can actually study with this disease. This vaccine was actually needed. So of course, when money comes, things push faster. So we received so much money in grants, billions of dollars in grants. And we're in the 21st century. So we have so much technology that we're able to produce these vaccines at a quicker rate. So I actually work at a COVID vaccine clinic. We see about 2,000 patients a day. So far, I haven't heard any patients report of any serious side effects with this vaccine. So I'm sure, everyone is concerned because this is something new, but I believe this is something that we seriously need.
So, do you still have to observe the COVID-19 protocols after the first dose and even after the second dose?
Yes, so of course, we still need to. Even though you're vaccinated, you might be able to carry COVID and give it to somebody who is not vaccinated, which can put them into some danger. So yes, we should still observe all the protocols, wash your hands, social distance, and make sure we take care of each other.
Awesome. Thank you so much for letting me interview you.
Yes, thank you so much, Jada. On behalf of HI, we really appreciate you coming on our show. And we definitely should do this again.
Yes, definitely. Take care.
Thank you.
All right, so that was the video. We will be putting it on our website, and we'll be putting it on our Facebook page as well. YouTube is going to be there. So just send it to people. It's just as a way to reassure them that they can actually get vaccinated, and there's no real side effects that are associated with the vaccine at this point. So without much ado, I would like to end this show today, and HI will bring you another session next week, an informational session, just keep you updated on what is going on in the vaccine front, what is going on in our health world as well. So without much ado, I would like to thank everyone that tuned in today. Thank you for watching. I want you to share the feed, and until then, we'll meet next week. So thank you, and take care of yourself. Make sure you protect yourself pretty much, because this whole COVID thing is in your hands now. You have every tool to do so. When it came in the beginning, it was hard, but now we know what to do. So please take good care of yourself, and I'll see you next week. Bye.
surpassed China related to this virus and the outbreak.
It no be wanna photo, say we dey fight corona. But as we dey take precautions, I get the feeling, say we go overcome 'em.
It no be wanna photo, say we dey fight corona. As we dey fight, we for pay attention, yeah.
For you sanitizer, once for seminar, and regularly drink water.
If you coughing or sneezing, nose masks be the new anthem, my guy. Yes, I wear anthem.
Charlie, social distancing to the end.
Stay home be the best option, really, yeah.
Exercise the body and eat healthy.
And at the end, we for pray to the Almighty.
Corona, I didn't be a banana, but we for take responsibility and keep fighting with positivity. Never spread calm, not fear.